Hello, Dr. Jeff Johnston coming to you from Denver, Colorado. Today I'd like to get a little technical with you guys um, and talk about how fillings are filled. There's some fillings that are just on the top of the teeth, and then there's other fillings that take up the sidewall of the teeth. And for the last 8, 9 years of my career, I've filled these fillings on the sidewalls of the teeth with a little band, and then you put a little wedge between it and wedge the teeth slightly apart. Um, the problems with this, though, are the materials we are using, uh, the tooth color materials. We set them up with a light cure, and they can shrink. They have a shrinkage factor to them. And so we're trying to create nice contacts between the teeth to get the teeth nice and connected back together. But when we're dealing with this shrinkage factor, it can be challenging to create. Another thing is we're restricted by the band. The band doesn't have the bulbousness of the natural tooth. So the contacts and the bulbousness of the sidewalls of the teeth are very hard to recreate with these bands. I'm excited that I'm moving into a direction where every sidewall that I do, I'm milling it out on a CAD/CAM machine, and so we're basically milling out your filling and then cementing it in. This way I can create that sidewall in more natural anatomy. It's more healthy on the gums and things like that. So it's kind of technical and hard to explain. It's a little detail that we do, but we're making all these things out of the machine now. So creating that natural sidewall that was destroyed by cavity. And we don't have to deal with any of the shrinkage factor in that as well, because once the material's milled out of the machine and we cement it down, there's no change in the material when we cement it in place. So that's the advantage of doing the fillings on the CAD/CAM machine versus trying to create the filling in the mouth. Like I said, we have to deal with this metal band to build the sidewall. That band could be flat, or we have to wedge the teeth apart. We're dealing with shrinkage factor of the material. So I just kind of wanted to explain that to you guys. That's how a filling on a sidewall of a tooth is completed. And I think it's really a much better process to take your time and mill it out on the machine and contour the sidewall and then cement it in place. So those are my thoughts on this, and we'll talk about some other stuff down the road. But we're starting to go to more of a milled filling now, and cemented in the mouth versus the direct placement. Okay, thanks.